So blood pressure, systolic blood pressure and diastolic blood pressure, it depends on cardiac output. Systolic blood pressure depends on cardiac output and diastolic blood pressure depends on total peripheral resistance. So last class we discussed mean arterial pressure. What is mean arterial pressure? Mean arterial pressure is equal to diastolic pressure plus 1/3 of pulse pressure. So what is pulse pressure? Pulse pressure is the difference between systolic pressure and diastolic pressure. So this is 80 plus 1/3 of 40. 1/3 of 40, 80 plus 13.3. That is 93.3 is the mean arterial pressure. This is what we discussed last class. Now I am going to teach one more thing that is called mean systemic pressure. Mean systemic pressure. So what is the difference between mean arterial pressure and mean systemic pressure? So mean arterial pressure is, as the name suggests, mean arterial pressure, it is a pressure which is present in the arterial side, right? And mean systemic pressure is the total pressure. That is, mean systemic pressure, it includes arterial pressure, capillaries, pressure in the capillaries and the pressure in the veins. So all together it is called mean systemic pressure. And this thing you know, 93.3 mmHg. So when you add the pressure of the capillaries and when you add the pressure of the veins to the, that is, in other words, it's a mean pressure of the total cardiovascular system. Cardiovascular system, total system. That is pressure in the heart, pressure in the veins and pressure in the arteries together. And it is very, very, very less. So it is about 6.5 mmHg. Mean systemic pressure is 6.5 mmHg. Mean arterial pressure is 93.3. So how it came? For example, you can this is arterial side, right? And this is venous side. Right. So if we are talking about mean arterial pressure, the pressure in the arterial side, right? This one, right? So this pressure is called mean arterial pressure, which is, this is what? Valve. Okay. So this side, this is called mean arterial pressure, that is 93.3 mmHg, right? So only in the arterial side, that is at any given point of time, right? During systole it is 120 mmHg. When the heart is beating, the pressure in the artery is 120 mmHg, and when the heart is relaxing or during the diastole phase, the pressure will be 80, 120, 80, 120, 80. Average pressure is, mean pressure is 93.3. That is in the arterial side, only in the arterial side. So if you add the pressure of capillaries and veins, right, that is total pressure. That is, I am talking about green color. Right? This pressure is 6.5 mm Hg. That is, you are along with the mean arterial pressure, you are adding the pressure of the capillaries and you are adding the pressure of the veins. So when you add all the pressure together, the mean systemic pressure is 6.5 mm Hg. Or in other words, suppose if the heart is not functioning as a pump, imagine if the heart is stopped for a period. Heart is not functioning, heart is not beating. Still there is some amount of blood left in the cardiovascular system. Blood to hai na? So that blood will create some pressure in the arteries and veins. Even if heart is not beating, some blood is present in the cardiovascular system, which will exert pressure on the arteries and veins. That pressure is 6.5 mm of mercury. If heart is beating, then artery side 93.33. If heart is not pumping, then throughout the cardiovascular system pressure will be 6.5 mm of mercury. Any doubt? Okay. So mean arterial pressure, listen carefully, mean arterial pressure is the pressure which is delivering the blood to the tissues. Mean arterial pressure is a pressure which helps to deliver the blood to the tissue. Suppose if heart is beating, right, normally mean arterial pressure will be 93.3 and that pressure will help in delivering the blood to the tissue. Right? If mean arterial pressure is 93.3, then tissues will receive normal blood at that pressure, right? Normal oxygenated blood will be received. So now next what should happen? The blood should go from the tissue to the veins and back vein to the right heart. वो कैसा होता है? That also needs some pressure. That pressure is mean systemic pressure. The mean systemic pressure is the pressure which takes the blood from the tissue back to the right atrium. Are you clear? So mean arterial pressure is responsible for delivering the blood to the tissue. Mean arterial pressure is the pressure which delivers the blood from heart to the tissue, and mean systemic pressure is the pressure which takes the blood from the tissue to the right atrium. And mean arterial pressure is 93.3, mean systemic pressure is 6.5 millimeters of mercury. This is normal. Any doubt? So we have discussed what is systolic blood pressure, we have discussed what is diastolic blood pressure, we have discussed what is pulse pressure, and we have discussed what is mean arterial pressure, and we have discussed what is mean systemic pressure. So totally there are 5 pressures we have discussed. Right? Okay. Now next topic is, what are the variables which is responsible to change the blood pressure? Variables which is responsible to change the blood pressure or to alter, which alters the blood pressure. Okay, I am going to give a chart, flow chart, and then I will explain you in detail. Okay, first is blood pressure. It is, as you know, there are 2 types of blood pressure. One is mainly blood pressure. It depends on cardiac output and total peripheral resistance. Blood pressure depends on cardiac output and total peripheral resistance. Cardiac output is responsible for systolic blood pressure, and total peripheral resistance is responsible for diastolic blood pressure. This you know already, right? Okay. So now cardiac output, it depends on 2 factors. One is stroke volume and heart rate, right? कार्डियक आउटपुट भूल गए क्या? कार्डियक आउटपुट इज इक्वल टू स्ट्रोक वॉल्यूम इनटू हार्ट रेट. स्ट्रोक वॉल्यूम is 70 ml into 72, 4900 ml or 5 liter. Cardiac output is 5 liter, right? So this cardiac output, it depends on stroke volume and heart rate. If stroke volume increase, cardiac output increase. If heart rate increase, cardiac output will increase. If both is increasing, of course, cardiac output is going to increase. Okay. So, any doubt till here? Okay. So, stroke volume. Stroke volume, it depends on three factors. Stroke volume, it depends on three factors. First is preload. Preload. I'll explain in detail. Second factor is contractility. Right? And third point is afterload. Afterload. Right? And now, preload is other cardiac cycle अभी नहीं हुआ ना. Preload is otherwise called as end diastolic volume. End diastolic volume. We will discuss later. So preload again depends on venous return. Venous return. And venous return depends on three factors. Venous return defect. I'll explain each and everything. Just I am drawing the table, flow chart. It depends on right atrial pressure. Right atrial pressure. And second is venomotor tone. Venomotor tone. And third is blood volume. Blood volume. Right? Okay. So now, venous return again, it is having few points I left here. Venous return depends on right filling time. One more thing will come, filling time. यहाँ पे filling time आएगा. One second. Filling time. Venous return, it depends on right atrial pressure, venomotor turn and blood volume. And secondly, it depends on the filling time. Are you clear with this flow chart? So now I will explain. See, if he's talking at the back, blood pressure and cardiac output, it depends on cardiac output and total peripheral resistance. Cardiac output depends on stroke volume. What is stroke volume? Amount of blood ejected by the heart in one heartbeat or one systole. And that systolic volume or stroke volume, the stroke volume, it depends on three factors: preload, contractility, afterload. So now first we are going to discuss preload. What is preload? If preload increases, listen, If preload increases, stroke volume will increase. If stroke volume will increase, cardiac output will increase. If cardiac output is increasing, systolic blood pressure will increase. First we will discuss what is preload and how. Okay. What is preload? Preload is this is left atrium and left ventricle, right? And what is this? Which wall? Bicuspid wall, and this is aortic wall. So preload. What is preload? The amount of blood which is present in the left ventricle just before contraction. Amount of blood which is present in the left ventricle just before the contraction, just before the systole. Okay. So imagine now the blood is filled in the left ventricle, and this valve is also closed and this valve is also closed. So what is happening? Now the ventricles are contracting, right? Ventricles are contracting and this valve is closed. So ejection is not happening. Ejection is going to happen, right? So the amount of blood which is present in the left ventricle just before contraction, just before systole, just before contraction of the, so that amount is called as end diastolic volume, end diastolic volume, right? If, listen carefully, if end diastolic volume is more, stroke volume will be more. जितना blood है उतना ही बाहर आएगा ना. If amount end diastolic volume is more, now when the heart is contracting, when the ventricle is contracting, blood will come out. What is that called? That is called stroke volume. Stroke volume. So stroke volume, it depends on end diastolic volume, right? If end diastolic volume increases, stroke volume will increase. If amount of blood in the left ventricle is less just before contraction, stroke volume will also be less, right? So if preload, or otherwise called end diastolic volume, if it is more, preload will be, end diastolic volume will be more, stroke volume will be more. When stroke volume will be more, cardiac output per minute will also be more. If cardiac output is more, systolic blood pressure will be more. That is 120 or higher. It basically depends on preload, right? Okay. So now, on the other side, right? So, what is next point here? Next is venous return. So what is venous return? Venous return is the amount of blood coming from body to the right atrium. This is called venous return, right? So venous return, if it is more, venous return, if it is more, then from here where the blood is going? all the blood from the right ventricle it is going to left atrium. यहाँ से कहाँ जाएगा? Through lung it will go to left atrium. Left atrium, then left ventricle. So from where this blood got? We got this blood from where? We got from here only. Are you clear?
Yes.
If venous return is more, then end diastolic volume will be more. If venous return itself less, suppose if less blood is coming to the right heart, less blood is coming to the right heart, less blood will go to the right heart, left heart. Right? So if less blood is going to the left heart, end diastolic volume will also be less. Are you clear?
Yes.
So end diastolic volume, it depends on venous return. If venous return is more, end diastolic volume will be more. If venous return is more, end diastolic volume will be more. If end diastolic volume will be more, stroke volume will be more. Stroke volume will be more, cardiac output will be more, and systolic blood pressure will go up. Are you clear?
Yes.
Now, again this venous return, it depends on two factors. One side, we will discuss 3 points. First is right atrial pressure. Second is venomotor tone. Third is blood volume. So first is right atrial pressure. So if the pressure in the right atrium is more, it will receive more blood. Right? If right atrial pressure is more, it will receive more blood, more venous return, more end diastolic volume, more stroke volume, more cardiac output, systolic blood pressure will go high. Right? And second is, what is second? Venomotor tone. So venomotor tone, that is tone, it's a tension or tension maintained in the venous side. Right? Suppose if the veins are contracted or venoconstriction, and if any drugs is given which will constrict the veins, right? If all the veins are constricted, so what will happen? All the blood will go to right atrium. If venous side, if the all the veins are constricted, so that blood will not go back to artery. It will go back to the right atrium. So if venomotor tone is increased, if tension in the veins are increased, blood will be pushed to the right atrium, which is called as venous return. So venous return will be more or less? More. Because all the veins are constricted and the blood will be pumped to the right atrium. Right? So venous return will more. So if venomotor tone is increased, venous return will be more. Venous return is more, end diastolic volume will be more, stroke volume will be more, cardiac output will be more, systolic blood pressure will be more. Right? And the last point is blood volume. Suppose if you are infusing a normal saline in the vein, normal saline, hospital mein saline. So what happens? Where that saline goes and it goes and added to directly to the blood volume, right? So what is the normal capacity of cardiovascular system? Normal capacity of cardiovascular system. If all the system, cardiac, heart, arteries and veins and capillaries, everything is filled, then what will be the maximum capacity of blood in the heart? 5 liters. So 5 liters is the maximum capacity, right? So when you are adding the saline to the what? Cardiovascular system or veins, venous blood, then what will happen? It goes and add up to the blood volume. So 5 liter, maybe it become 5.5 liter. So more volume is there, blood volume is there. More volume, so venous return will be more. Venous return, because normally 5 liter blood goes back to the right atrium. Now instead of 5 liter, 5.5 liter is going. So venous return is increased. Right? So blood volume, when it is increased, venous return is increased. Per minute, 5 liter is crossing the heart and lung. Right? So now in this case, 5.5 liter should cross. So venous return is more. Venous return is more. End diastolic volume is more. Stroke volume is more. Cardiac output is more. Systolic blood pressure will more. Are you clear?
Yes.
So, we'll go reverse. So due to any road traffic accident, blood loss is there. Instead of 5 liter, 1 liter blood is lost. Available is only 4 liter. Blood itself 4 liter available. Will the right heart will receive 5 liter?
No.
Venous return will be less or more?
Less.
Venous return will be less. If venous return is less, then opposite side heart will also receive less blood. So now now it will be partially filled. Which one? End diastolic volume will be less. Right? Because heart body itself is not having 5 liter. Less blood is right heart is receiving. Less blood left heart is receiving. End diastolic volume will be less. And if end diastolic volume will be less, definitely the stroke volume will be less than 70. It will be less than 70 ml. Because 70 ml will not come. If 70 ml is coming, then cardiac output will also less per minute. Instead of 5 liter, it will be less than 5 liter. So if cardiac output is less, then systolic blood pressure will also be less. Are you clear?
Yes.
Venomotor tone, if it is reduced, you are giving any drugs which will dilate the veins. Veins are what happened? Instead of constriction, veins are dilated. When veins are dilated, pressure could not be maintained. 6.5 millimeter of mercury, that is mean systemic pressure will be reduced, right? So the blood will not reach, even though the body is having 5 liter, because the veins are dilated, pressure is not maintained for venous return. So the blood will be pooled in the veins and it will not go back to the right atrium. So venous return will reduce. So if venomotor tone is reduced, venous return is also reduced. Okay. And if right atrial pressure is reduced, again venous return will reduce. Right? And rest thing you know. Right? And here, filling time. Second component for venous return, filling time. What is filling time? Who can tell what is filling time? Filling time. What is the filling time? Duration. What is the duration of the filling time? Filling time क्या है? कितना है? 0.0.8 seconds. 0.8 is cardiac cycle. What is filling time? Yes. Who told? कितना? Point? Wrong. 0.5 cardiac cycle. कितना? Systole plus diastole. Systole time is 0.5. Diastole is 0.3 second. Total cardiac cycle is 0.8 second. उसमें contraction is Heart will contract for how many seconds? Systole. How much? Yes.
0.3.
Heart will contract for 0.3 seconds. 0.3 seconds heart will contract. Right? So in that phase blood will come out. Right? How many seconds heart is relaxing? Diastole.
0.5
Point
seconds.
it is 0.5 seconds. Right? So 0.5 seconds left ventricle is receiving blood from the left atrium. Right? 5 seconds it is receiving blood and 3 seconds it is contracting. Right? 5 seconds is the period where the left ventricle is filled. So that is called filling time. Right? So filling time is, duration is 0.5 seconds. Right? How this 5.8 second came? How this 0.8 second came? Huh? Per minute 72 contraction per minute. In 60 seconds, heart beats for 72 times. So one heartbeat, that is one systole and one diastole. It is 0.8 seconds. Right? If heart rate is 72, then cardiac cycle is 0.8. Am I right?
Yes.
Okay. Suppose if heart is beating for only 60 times, what is cardiac cycle?
1 minute.
1 minute.
Yes.
Sorry, 1 second. Right? It is 1 second. That is 1 second. What is 1 second? It is one systole and one diastole. Together it is 1 second. But heart is beating for 72 times. So duration should be less. Duration should be less. That is how 0.8 second came. And 0.8 second is, it is 0.3 and 0.5. So 0.5 we are calling as filling time. Are you clear what I am saying? So now, instead of 72, if heart rate is increased more than 72, right? For example, 90, keep it, for example, 90 times heart is beating per minute. What will happen to the duration? It will increase or decrease? It will decrease. Because heart is beating for more time. One heartbeat will be very fastly completed. Right? One cardiac cycle will be completed very fast. Right? So if it is completing fast, then duration will become less. Right? So instead of 0.5, it may become 0.3. Suppose if it is becoming 0.3. And this will further reduce. This will also reduce and this will also reduce. Right? So filling time, what happened? Filling time will reduce. When the heart is beating, tachycardia. It is called as a tachycardia means number of beats per minute is increased. Bradycardia means number of cardiac cycle is decreased, right? In case of tachycardia, in case of severe tachycardia, what happens? The filling time is reduced. What does it mean? The ventricle is relaxing for less time. Right? Normally it should relax for 0.5 seconds. But if it is relaxing only for 0.3 seconds, then time to get filled is reduced. Are you clear?
Yes.
The time for left ventricle to receive the blood will reduce. Immediately after 3 seconds, what happens? Heart is contracting. So the blood is, if it is receiving less blood, then it cannot pump more blood. Are you clear?
Yes.
So, when the filling time is less, which volume will be less?
And
End diastolic volume will be less. When filling time is less, end diastolic volume will be less. If end diastolic volume is less, stroke volume is less. Stroke volume is less, cardiac output will less. If cardiac output is less, systolic blood pressure will be less. Are you clear? Opposite to that, if filling time is increased, filling time is increased. Okay, one more point I would like to say. See, cardiac output, already we discussed cardiac output, it depends on stroke volume and heart rate, right? Stroke volume into heart rate. The previous lecture I have told that cardiac output will increase if stroke volume is increased, right? And or cardiac output is increased if heart rate is increased. In both the condition, in both the situation, cardiac output will increase. But now in this lecture I have told that if heart rate is increased, cardiac output will decrease. Now I am telling opposite. Are you clear what I am saying?
Yes.
Usually if the heart rate is increasing, cardiac output will increase. That is in the beginning. Earlier stage, if heart rate is increasing, cardiac output will increase. But if the cardiac heart rate is severely increased, right, up to certain level cardiac output will increase. But if heart rate is too much increased, then filling time will become too much less, and then cardiac output will drastically, it will go down, right? In the beginning, heart rate, when your heart rate is increasing, cardiac output will increase, but it is maintained for long time, or if it is severe tachycardia, filling time will be reduced, end diastolic volume will be reduced, stroke volume will be reduced, cardiac output will go down. If heart rate is severely increased, then after slight increase, then cardiac output will go down because filling time is less. More?
Less.
Filling time is less, end diastolic volume is less. Any doubt? Right? Filling time. And last, and two more points. Contractility and afterload. What is contractility? See, if the heart is filled completely, Stirling's law. According to Stirling's law, the contractility of the heart directly depends on the stretchability of the wall. Right? जितना stretched है उतना effective contraction होगा. If more blood is filled, then the muscles are stretched. That is before, I am talking about before systole. Systole is going to happen. If blood is completely filled, if the left ventricle is filled completely, then contraction according to Stirling's law, if more blood is filled, then the heart musculature are stretched well. If it is stretched well, then contraction will be more effective. Right? So, a bow and arrow. And if you stretch more, force will be more. Right? If the muscles are stretched more, then the contraction will be more effective. So if contractility is even though blood is full, if muscle is not contracting, or in an example you can take a myocardial infarction, heart attack. Myocardial infarction में क्या होता है? Muscles are weak pump. pump weakly. Blood is there, but heart is not pumping properly. So if heart is not pumping properly, then end diastolic volume is normal. It is normal, but heart itself is not pumping. So 70 ml will come? No. 70 ml will not come. Stroke volume will be reduced, cardiac output will reduce, systolic blood pressure will reduce. If contractility is good, stroke volume will be normal and blood pressure will be normal. Are you clear? Now last point. What is last point? After load. After load. So what is after load? After load is nothing but total peripheral resistance. See, I will draw two diagrams. I will make a make it in blue color. Okay, this is one diagram. This is another diagram. And here the valves are closed. Here the valves are open, right? Here the valves are closed. Okay. So imagine the blood is now in this first figure. The ventricles are contracting. Ventricles are, that is during systole, right? What happens? The blood will come out, right? And the blood is, now it is collected here, right? So this is now the arteries, arterioles, right? When during ventricular systole, the blood is ejected and now it is available in the arterial system, right? So if the resistance is more, total peripheral resistance is more, what will happen? Blood will be collected here, it cannot move further. It will not move because of the resistance, total peripheral resistance, the blood is pooled in the arterial side, and which pressure will go up? Which pressure will go up? Total peripheral resistance. If total peripheral resistance increases, which pressure will increase? Diastolic pressure will increase. Right? So now blood is pooled here. Right? Okay. Now the blood, now what happened in the next figure? Now it is closed and this will open, right? And now this is open. What will happen now when the ventricles are relaxing? Now this is which phase? This is diastolic phase. After systole, now it will relax. So during diastole, what will happen? Blood will enter into the left ventricle, right? But now, what happened here? The blood is still there. Why? Because of resistance, blood has not gone. So this load is called as after load. Right? After systole and during diastole, if the peripheral resistance is more, blood is collected in the arterial side, or in other words, after load is increased. After load is increased. And next systole, when the heart is contracting, blood cannot move forward because already
There is blood.
blood is collected in the arterial side. After load is more here. So the less blood will go out, less blood will be ejected out. That is, stroke volume will be
Less.
less. So if afterload is more, stroke volume will be less. समझ में आया क्या? Any doubt? And if there is no if total peripheral resistance is less,
After
all the blood will
go out.
go out. So now artery is ready to receive blood. So if afterload is less, then stroke volume will be normal. If stroke volume is normal or stroke volume will be more. समझ में आया क्या? Because afterload is, there is no resistance. Afterload will be less, stroke volume will be more, cardiac output will be more, systolic blood pressure will be more. Right? So, if afterload will be more, stroke volume will be less. Right? Stroke volume will be less, cardiac output will be less, systolic blood pressure will be less. And opposite to that, if afterload is less, when the afterload will be less, if total peripheral resistance is less, afterload will be less. If afterload will be less, then stroke volume will be more, provided if contractility is normal.
Normal.
Stroke volume will be more, cardiac output will be more, systolic blood pressure will be more. Any doubt? And this is already we discussed. Total peripheral resistance is more, diastolic blood pressure will be more. Total peripheral resistance is less, diastolic pressure will be less. So these are the variables which is responsible for change in blood pressure, either systolic blood pressure or diastolic blood pressure.